here you see the tibialis anterior muscle. Tibialis anterior muscle is a really long, thick muscle on the lateral surface of your leg. So right by your shin bone, laterally, you can feel the tibialis anterior muscle. And this muscle is actually a part of the anterior compartment of the lower leg. It originates at the lateral condyle and the body of the tibia. So if I isolate this muscle right here, it looks a lot more clear. You see it originates at the lateral condyle and the body of the tibia, and it inserts into the first metatarsal, which is really the big toe. So it wraps itself and inserts itself under the bottom of the foot. The function of this muscle is to dorsiflex and invert the foot. So in this video over here, you're able to see the dorsiflexion of the foot. Dorsiflexion really is the action of raising the foot upwards towards the shin. So this is dorsiflexion. The other function of tibialis anterior is foot inversion. So when this foot is getting inverted, you can see this muscle contracting and pulling the big toe inward to invert the foot. One condition associated with tibialis anterior is Shin Splint syndrome. The Shin Splint syndrome, simply known as Shin Splint, is the pain or soreness that is associated along the tibia. Specifically, the medial distal 2/3 of the tibia. What causes shin splint? That is caused usually by the tendinitis, that is inflammation of the tendon in the anterior compartment of the muscle. It can happen when somebody has stress fractures, and tendinitis usually occurs when poorly conditioned runners, they run on hard or banked surfaces with not enough support in their shoe. And it can also occur due to very vigorous activity of the leg following a period of inactivity. So when somebody hasn't worked out for a long time and suddenly goes for a long run without getting conditioned, or without a proper warm-up, it can cause shin splints. And this muscle in the anterior compartment can be strengthened to balance the stronger muscles over here. Okay, so warming up and stretching and conditioning is the way to go. Now, if you look at the back of the leg, you have the posterior compartment of the leg, which is actually made up of some superficial and some deep groups. The superficial muscles share a common point of insertion. So all of them insert into this tendon over here. This is the calcaneal tendon, or it is also known as the Achilles tendon. This is the strongest tendon of the body, but this is a tendon that can be injured due to wear and tear, and this tendon does not have enough blood supply. So when injured, the Achilles tendon is very, very difficult to treat. So it takes a very, very long time to heal as well. Okay, so the superficial muscle that we are looking at are the gastrocnemius. The gastrocnemius is the muscle that you can feel when you touch your calf. Okay, and right under the gastrocnemius muscle, this is the soleus muscle. Soleus muscle is a broad, flat muscle which looks like a flat fish or sole. That's why it's called the soleus muscle. Okay, so now let's look at the points of origin and insertion for gastrocnemius. Okay, one thing I forgot to mention is that the gastrocnemius and soleus muscles together are called the tricep surae muscles. Okay, so the gastrocnemius muscle have 2 points of origin. So gastro literally means belly, okay? So these have 2 points of attachment, insertion. So this one over here is the, let's see, this is the medial head of the gastrocnemius. So this is the medial condyle of the femur, and this one over here is the lateral head of the gastrocnemius. So this in points of origin becomes the lateral condyle of the femur. Both of them insert into the calcaneus or the heel through the calcaneal tendon. So this over here is the Achilles tendon. Their function is to plantar flex the foot and flex the leg. So let's see them in motion. So you are looking at plantar flexion of the foot. Plantar flexion is basically walking on the tippy toes like ballet dancers. That's called plantar flexion. Okay. The other action of gastrocnemius is to flex the leg at the knee joint. So there are other muscles that are involved. So we can see the bicep femoris. This is the long head of the bicep femoris, and this is the short head of the bicep femoris. If you rotate the leg, this one over here is the medial head of the gastrocnemius, and this muscle over here is the semitendinous muscle. If you rotate it medially again, you can see the semimembranous muscle. So these are the hamstrings. And this one over here shows the action of triceps surae. So there are 2 functions of gastrocnemius. To plantar flex the foot, meaning to stand on the tippy toes, and then to flex the leg, meaning decrease the angle of the leg at the knee joint. Now what you're looking at is the soleus muscle. I just hid the gastrocnemius. The gastrocnemius are the superficial muscle. The soleus muscle that you're looking at right now are deep to the gastrocnemius muscles. Okay. So the soleus muscle originate at the head of the fibula. So that is the head of the fibula. If you isolate this muscle, turn it around, just the back of the leg, you see the head of the fibula. That's the head of the fibula, and it inserts into the calcaneus. And the function of gastrocnemius is also to plantar flex the foot. So the soleus is actually the most important walking muscle. Okay, so if you go back and look at the insertion of this muscle also inserts right at the calcaneus, along with the gastrocnemius muscle.